our slides. While I'm doing that, just want to welcome everybody again to the How to Support Mutual Aid and Community Action to Address COVID-19 webinars. This is the first series in a 4-part webinar that we, Community Science, are putting on just to really start raising the awareness and get out there and really take part in the conversation that's going on with the pandemic and responding to it at the community level, as well as the city, national level, and really trying to support those efforts. I don't think my screen is, there we go. Okay. So on today, we will be covering a few things, but just wanted to start off with a quote to kind of level set for everyone. A community is not resilient if it's not equitable. And essentially, that's really a value that drives us at Community Science, as well as the panelists, I'm sure. And just to understand and that even the lowest, less resourced person in our community needs to be as strong as everyone, or else we're not really taking care of each other, and we're not going to move forward and progress. So the agenda for today, well, actually, as moderating is myself, Daniel Pagan. I'm a senior analyst here at Community Science, and we also have our president CEO, David. And we'll be co-moderating the panelists as well as just the discussion as we go on. Part of what we want to cover today, David will start by discussing why this webinar, what we're really hoping to achieve. We'll also introduce each of our panelists, and then really have more of a panel discussion. We're trying to make it somewhat interactive. So definitely place your questions in the chat as we go. And we'll leave some time in the end to answer those audience questions. We also want to introduce a community action learning network that we are working to put together, and any additional resources we could share. As just some housekeeping, of course, that we are recording this, so I hope that's okay with everyone. And we will be sending the recording out afterwards to all the registrants and anyone who's interested, along with a document of resources that are discussed or shared today. So, because we realize there's a lot of questions out there, we've had a lot of interest in this, but we may not be able to cover everything, but we will try our best. With that, I want to kick it over to David.
Great. Thank you, Daniel, and thank you everyone for joining this. This has been a 2-week flying the plane while we're putting it together, so I really appreciate everyone's patience. We've drawn on panels from across the country, and I want to thank them as representing all the great work that many of you in the audience are doing, and the hundreds or thousands of responses from long-term and short-term efforts to begin to respond to this national pandemic. I wanted to, re-emphasize the quote that Daniel just meant from Angela Glover Blackwell, because not only is it value, but it's a scientific fact. This community science, the truth, the facts point the fact that we are in it together, that the resilience comes from being able to, everyone being treated equitably. And that's what we're hoping to do. So while we have we're seeing people coming together across the country and across social and economic divisions to care for each other. And we think that this is a great opportunity for us, and something that we want to begin to think not only about the immediate, which we have to do, but the long term. So we started this webinar, and some of the other work that we're doing and with others is that because we realize that there's also a diversity of communities that are affected in common and in unique ways by the COVID-19 pandemic, and we have to be more aware of that. Obviously, we have immediate needs, but there are many other needs that we have to begin to prepare ourselves. That we all know that these inequities are worsening at a high human cost among diverse communities. And to quote, Governor Andrew Cuomo of New York, why do the poor always pay the highest price? Why do they have to pay the highest price in this? And so that really motivates us. And there is more than just, unfortunately, more than just the poor we have to address. As much as this pandemic, these is a disaster, it's also an opportunity to make major social changes. And in order to do that, we have to be able to build the capacity and collaboration among mutual aid and community action efforts to respond, recover, and result in healthier, more just, and equitable communities. What we hope to get out of this, the result of this, if we can go to the next slide. Okay, is to increase the visibility and attention to mutual aid and community action among diverse communities. You know, it is an overwhelming situation, there's no doubt about it, but we're not hearing the voices in a lot of the successes and how people are coming together, especially people in diverse communities, to respond to this. So while we have to honor our first responders, we have to understand that behind those first responders in this long recovery are all the mutual aid and community action groups that are working around the country and that will continue to work far beyond the end of this pandemic. We hope that in working together with other groups, we can establish a national learning network and communications network across these communities to build capacity. You know, we're very siloed in community organizing, community action work, and so we're hoping to bridge that. There's a lot of information coming out, and like other disparities, though there are those that are getting the information quite quickly and in forms they can use, and many others who could really use that help more that don't get that information and be able to respond to their community needs as well as their family needs. So that's really critical, and we hope to begin to start with this webinar and the webinar series that we're doing, as well as other work to continue that capacity building in that network. And that to increase the support for mutual aid, community organizations, and grassroots advocacy efforts that promote equity for all people during and beyond this crisis. That's a critical thing. We want to draw attention. We've been focusing on government and foundations and hope others will join us in that regard. What I'd like to do next is to introduce our panel, okay, for today. And I'm very excited we've gotten to meet everybody. These are just great examples of the diversity of work and different types of communities that are going on. Obviously, we can't be all inclusive. Town Hall Project identified at least I believe 150 groups alone. We know that there are thousands of groups that are already there ready to go. But here are some good examples of the diversity. We have Lahia Gualpa from my favorite place, Brooklyn, New York, with the Workers' Justice Project. Sammy Hampton from Grassroots Community Activists. They've been working on so many issues that I'm sure they will introduce them as they go along in their presentation, but dealing with neighborhood issues as well as those workers, sex workers, and other sexual identity, gender identity issues. Tyson Jackson, Director of Organizing at the People's Action Advocacy Institute in Jackson, Mississippi. Zach Margulies, who's organizing in his neighborhood in the Abel and Charles Village here in Baltimore, which is also where I am right now. And that I think one exciting thing is showing how community groups can work not only among themselves, but across class and race to be able to respond to this. And Zeeman Zhao, who's the Director of the Mayor's Office of New Americans, will talk about the work that immigrants and refugees are doing in Salt Lake County in order to be able to respond to this pandemic and beyond. So with that very quick introduction, we've asked, I'm going to go around and start with our panelists talking about their individual work, what they're doing, their successes, and to get this started. So, Lucia?
Yes. Thank you. Can you hear me? Yeah. So thank you so much for inviting me to be part of this dialogue. So I work with Workers' Justice Project. We are a Brooklyn-based worker center that educates, organizes, and fights for better working conditions in the workplace and in the community. And at the moment, we are continuing to fight to protect workers, essential workers on the ground, doing direct services, but at the same time, we're supporting with organizing efforts, workers who are trying to organize to get paid sick time leave, to actually creating funds and resources for workers to be able to get access to food, resources, so they can survive in the epicenter of the pandemic where workers are dying, are getting sick, and alone and without care.
Thank you. Sammy. How's it going, Sammy? Are you able to? I'm sure we have a lot of empathy out there for people who've done webinars and dealing with technical problems right now. Feel that empathy. It's good. Compassion's good. Sammy, are you able to connect?
I think they are still trying to work. Oh, there you go. I saw the mic come on.
Can you see me?
We can hear you. That's a plus.
Okay. All right. Well, I apologize. I'm on my phone because my laptop is still in the mail. So what I've been working on the Old Goucher Barclay Community Response Team and Mutual Aid Group, which is part of a larger network here in Baltimore. We were created in response to COVID, and that basically our government isn't doing enough for the people. And so our community immediately mobilized, and we started creating teams in neighborhoods, and we created networks of people who wanted to help and people who needed the help. And so we are working to pair up volunteers who are able to go to the grocery stores, go pick up prescriptions, who are able to walk the dog if someone is sick and isn't able to, whatever the needs might be. We are trying to evolve as needs come up, and where things are very fluid, and I'm really impressed with the community and how quickly things have grown and evolved. And I'm new to the community as I relocated here in December. I moved from Rhode Island to Baltimore. And you asked about successes, and actually, even though there's been so much success in this group here in Baltimore, one of the more clear successes I actually had with in Rhode Island, I've been helping with digitally help organize another mutual aid group in Rhode Island. And a personal friend of mine ended up getting the virus, and they posted that they needed to get a CPAP machine. And so I simply made a post in a Facebook group for people with a rare disorder that I have and said, hey, does anybody happen to have this machine? And so by some miracle, someone did. And my friend was able to recover at home with the help of this breathing machine, and they are now recovered from the virus. And like it was just a very small thing, but it had a really big impact on this person. And that is probably the most tangible success that I've had. But there's just been so much beautiful success that can be measured in so many different ways. And I'm just so proud of my community here and so honored to be a part of this project.
Thank you, Sammy. Tyson.
Hello, everybody, and thank you, Community Sciences, for having this webinar conference and being able to bring people together to talk about how we are dealing with COVID as a community. Here in Jack.
Okay, showbiz. Okay. Tyson, we lost you.
Hello? I'm sorry, can you hear me now?
Yes.
Yep.
All right, sorry. Here in Jackson, Mississippi, where in Mississippi is the most food insecure state in the nation. We look at roughly around 20% of our residents in the whole state are dealing with food insecurity all the time. And also looking at in the city of Jackson, where we have mass density, the residents here, we look at food insecurity in some neighborhoods up to 60%. In some dire places where we don't have accurate estimates, but I will say it, we are nowhere close to about 70, 80% just based off of the resources that are there in the community and the population there. However, what we have been able to do through People's Advocacy Institute, through working with the City of Jackson, the Jackson Mills Matter program, a coalition of community people, especially the medical students, the medical students from UMC. Those medical students have been able to help us get resources as well as put together a unit where we are now able to get food to those in the community. Through People's Advocacy Institute, our work has been primarily within these communities. We work with all populations, but specifically we work with populations that are returning citizens or formerly incarcerated people who are coming back and trying to enter back into society. And we also work with children and the elderly a lot. So we look at those populations as some of the most at-risk populations when it comes to not just contracting the COVID disease, COVID virus as it is, and we're looking at how that effect is on African-American communities. We also know that this community as well, my community, and I won't speak of it as if I'm not.
Great. Okay, I'm going to take it as a break. And so
I'm sorry.
thank you.
I'm sorry, you all. Yeah, but that's my intro.
Thank you, Tyson. Great. And Zach.
Hi, everybody. Thank you, Community Science and David and Daniel for hosting this. I feel very flattered to join the panel with people who've been doing this work for a long time. I've met my new friends, David and Sammy, who are here in Baltimore, have kind of been with us through this process of building this mutual aid group, which similar to Sammy is a part of this larger Baltimore network of mutual aid groups, and we follow a similar model of a pair system of pairing neighbors who want to help with neighbors who need help. So we help people. Oftentimes, it looks like grocery store runs. Some people do not have, as you know, food resources and don't have the money to pay for it. So we do our best to connect people with places that are distributing food for free. Because that is a big need right now. So I think that some of the things that we've worked on recently that have been really important to me that are huge successes is we've sprung up over the last 2 months in Baltimore. Like Sammy said, there's been failures on multiple levels of our government, from the federal down to the city level, where people that need basic resources are not getting them, whether that's access to a safe place to live or food. So, the grassroots activists need to step in and have to bridge that gap. It's unfortunate truth, but it is what it is. So, and so something we've done that I think just recently, we have somebody in our group who we connected with that was really struggling with not having a nebulizer or some medical equipment that they needed to survive. And were not insured. They didn't have health insurance and didn't even know how to connect with those resources because linkages of care are, not always easy. So over the last day or two, we've been able to connect that person with nebulizers so they don't have to worry about that again. And we're trying to, in a case management style, connect them to all the things that they need so that we can make them whole again. So I'm really proud of that. I think that we have an amazing group of volunteers that kind of recognize the seriousness of the situation, have really stepped up. And yeah, I think that is kind of a good, I think one element too that I should mention is that our group does our best to connect with other groups that have been doing this work for a long time. So we're not reduplicating their efforts, but two, can really support, so we can work on this together in solidarity. I think that's a big element of what we're trying to do.
Great. Thank you, Zach. And that's great. It's a great example of working within your community, across communities, and that effort that is in many cities that are beginning to coordinate their efforts on a larger area. Z.
Hi. Good afternoon. Can Can you guys hear me okay?
Yes.
Okay, good. So I want to thank Community Science as well for inviting me to be at the table today, particularly highlighting the needs of immigrants and refugees in non-traditional gateway cities such as Salt Lake City. So I'm really pleased to be here and really share some highlights and unique struggles of a new American population. So at the in Salt Lake County, 12.7% of our population are foreign-born. That surprised a lot of people sometimes because most people don't think that there are immigrants and refugees in our communities. That is about 120,000 folks, residents who are here. And my job at the Office for New Americans at Salt Lake County really is to help the community understand the intersections of immigration, equity, and social cohesion. If you're not able to provide equitable services, the social cohesion piece is missing. So I've been doing this work for the past 20 years or so. We really focus on looking at the systems and the infrastructures and making those systems and infrastructures are in place. And oftentimes in up and coming communities like Salt Lake, we don't have those basic infrastructures in serving the new American immigrant and refugee population. I think one of the biggest successes that we have seen so far is really what the community mutual organizations are doing. As a government agency, we have to listen to what the community's needs are. We can make decisions for people. They have to come up with the decisions. And I think our job really is to listen to what those needs are, what the solutions that they have come up with, and make sure that those are in the forefront of policymakers and decision makers. I think one of the most important things that we recognize and as a gap in the community is access to language access. How do you provide language access as the first step, but how do you convey the message in a culturally appropriate way? Who are the trusted messengers that are in your communities that could help you with that? So that is what we've been doing, is really leveraging on the relationships that we have to be able to meet the needs by working with the communities themselves.
Great. Thank you, Z. And thank you all. And I said, these are, great panels. I've been really fortunate to be able to speak to, email with lots of groups around the country, grassroots efforts like these, Habitat for Humanity, church-based groups. These are just representative of some of the marvelous work that are going on around the country. I wanted to get back to Daniel. We'll have 3 polls during this to take full use of this technology to really show how Murphy's Law does rise to any occasion. And let's give that a try. Daniel, sorry. So if everybody can take their time right now, and we'll give you 1 minute to kind of click. We like to get quickly. Who are you? Please press 1. I guess I get to press 2. No. That's what it says. Organizers and panelists don't work. Okay, I'll follow instructions. Hope everybody is doing better than me.
Okay. I think everyone's basically in.
Okay.
Go ahead and close this.
And will we be able to see the results?
That's a big question. So about 80% of people were able to respond in, and it looks like we have about 45% of people who are researchers, consultants, or evaluators, 27% responding as community nonprofit, 11% as foundation or government, and 10% as other, with 8% from members of a community action or mutual aid group.
Mm-hmm. Great. Okay, well, thank you so much. And that shows the importance that we have to of the outreach to these groups that are doing the work on the ground. I'd like to move on then to the discussion for our panel. So if we can get that next discussion questions up in the slideshow, then we can get that moving. we put together some questions, you know, in advance to get the panelists going. And so we'll go through that. We'll also be, many of you put down, we have a huge number of questions when you registered that we're also going to try to introduce here. But if not, we're going to create a discussion on the event. We'll let everybody know, continue this discussion around some of these questions on a community bulletin board as well as on Facebook to continue this sharing. The first question I'd like to really raise right now is, and I want to rephrase this first question to be a little bit more to the point, which is, can you give us examples of where there are, you know, new efforts and opportunities to work across race, class, income, and other differences? What do you see happening in your communities and in your work right now? Are those new relationships and being able to work again across race and class and other divisions? Lahia?
Yeah. So, well, thank you so much. You know, Work Justice Project, mostly it's a membership-based organization. We work with low-wage migrant workers, particularly day laborers, domestic workers, restaurant workers. And as in New York, you know, there's many crises that are happening at the same time. It's not only the pandemic. There is a huge amount of unemployment that's happening. We have a healthcare crisis in New York. We have an educational crisis where, you know, kids are being asked to do virtual learning when families don't have internet. You know, in New York, I think you might have heard it in the news. It is true. New Yorkers, particularly poor, day laborers, immigrant, migrant workers are the people who are more likely to die and the ones that are getting sick and dying and fighting to survive in New York City. And that has moved us to do something different, right? Most of our work for the past, you know, 10 years in the organization, our work has focused a lot on making sure workers know their rights and organizing to be able to protect our community in the workplace. And as employers and businesses have shut down and they're also changing the demands, we're also trying to figure out how we shift around our work and combine our organizing efforts to social service efforts as well. And that has led us to figure out how we can do work differently, but also find new partners. In New York, as we're going through this crisis, the beauty is about how different people are coming together to respond to the crisis. In our recent efforts, we have seen people donating to our fund so we can have relief funds available to workers who are not working and have lost their jobs. And it's for the first time ever, we're seeing not only, you know, the traditional foundations coming up, but I think we're also seeing seniors who are also at risk making individual donations. We're seeing people that are, you know, are possibly more privileged or have better resources being able to offer and volunteer their time to be able to share their own food with other families, willing to make deliveries to New Yorkers who are not able to leave their homes. And I think that it brings an interesting case where, you know, we have in New York, we have groups, you know, we have a lot of community groups in New York City. And I think very often a lot of community groups work in different in silos and not necessarily together. And this is the first time ever that I'm seeing like Worker Justice Project community working with environmental groups who, you know, care so much about how this is impacting not only our community, I mean, the environment, but also the community and how we can respond together. We're seeing also, you know, in New York, we have neighborhoods where, you know, people have that have come in and gentrify our neighborhoods, where they're also trying to figure out how they can respond. And one of the things that we have seen doing it recently is a group of people who want to donate sewing machines and materials so workers can make masks. so they can protect themselves. These are some of the efforts that are happening in New York in how we are responding, but we're also seeing community members from different backgrounds, from different races, from community groups that are addressing different issues, trying to respond together and understanding that there is a need to respond together now more than ever. Hello?
Oh, you're muted, David.
I'm muted. You see, it's always the one who's reminding everybody. Okay, so Sammy, that's all I was saying anyhow. Do you want to go or can you go? And also unmute.
So the way that I see my community connecting new relationships is that a project that I've started is that I'm creating these care packages, which are backpacks filled with supplies needed for people that are unhoused and are in the more vulnerable populations, like sex workers, folks struggling with addiction, people that are on the streets and don't have the ability to isolate in their house or wash their hands on a regular basis. And these care kits are filled with supplies like snacks and water and toiletries, basic things that we take for granted. And I've been seeing a large number of people that are in the more gentrified, upper class, white neighborhoods that are coming out in droves to support this project and coming and donating, you know, granola bars and fresh fruit and all sorts of supplies that we need, so that folks that they normally wouldn't interact with can have some supplies and just have a little bit of human dignity. And I'm trying to get the word out because a lot of people aren't thinking about the fact that if you don't have a home, you can't wash your hands whenever you need to. You can't isolate, and folks that are unhoused are going to be trying to, you know, use the stores that they normally use to go to the bathroom and can't because stores are closing, and the libraries are closed. The things that they usually use for resources are shutting down. Everyone that I talk to that want to help people is like, oh, well, we can just direct them to the organizations that normally help people, but so many of them are reducing the services that they're offering, or cutting their services completely. And so these people that are already marginalized and oppressed are having the few lifelines that they have cut completely. And so we really need to support them, and there's no way we can get a handle on this virus if we don't attend to the needs of those groups. And so I'm really appreciating the fact that people in the more gentrified upper class neighborhoods are finally listening to me and hearing that these people need our compassion and hear that this is what's going on, because a lot of these people don't even think about those kinds of things and don't realize how much harder it is to fight off the virus when you're hungry and you're dehydrated and you don't have a place to get proper rest. So I'm just really appreciative of the community coming out and trying to understand what it's like to be in someone else's shoes.
Great. Thank you, Sammy, very much. I'm glad you brought that perspective to our conversation. Tyson.
Hello, everybody, and I do apologize when I was trying to do my intro. Actually, at that moment, we had someone, a delivery driver, who was delivering a truck of food from one of our distribution locations. He was calling me because I was the point of contact. I'm like, no, not now. But so I apologize. Yeah, I apologize kind of for not giving a full intro there, but nonetheless, this has been a great experience that we've seen here in Jackson, Mississippi, with diversity of groups, people who are coming to help get this together. Like some of the other panelists, we have a food distribution method that we're using in order to get food and resources to the community, to families and individuals who are in need. And we have our volunteer system set up where anybody can volunteer to come and drop something off to a person that cannot get out, who's immobile, whether that's elderly or just those who don't have transportation because of the way things are set up in our city and because of economic reasons. So we are making sure that the food can get to those families. So the volunteers have come from all over our city, every ethnicity, class, what have you, gender, doesn't matter. We've had everyone step up to helping out. However, the most unique relationship that I see that has happened is relationship between the University of Mississippi medical students who have stepped in and helped out tremendously from day one. They helped organize all of this together. They came with compassion. Most of them see members of our community on the other side, whether that is in the emergency room or coming in because they're sick or because they don't really get a chance to get into how they live. This has given an opportunity for them to see the same community that they serve through different lens. And that has been a great experience, just listening to them and the practical knowledge that they're gaining just from seeing the human side of people, not just, the sick side. And I mean, I know that's human as well too, but this opportunity to see how they live, because now they're out delivering to some of these communities. They're interacting with people in these communities to see how they live on a day-to-day basis. And in the city of Jackson and Mississippi, where poverty is a stranglehold on most of our state, and specifically here in our city, the ranges of people that you see and the conditions that they live in is very adverse, and they get a firsthand chance to see that. So I think that is probably the most unique and diverse thing that I've seen happen.
Great, thank you. Great, and that's what it is. I think we see so much of the negative about people. It's great to have the opportunity to see the positive and what most people are really about. So it is important to elevate that. Zach?
Hi, yes. So kind of echoing a lot of what has already been said, but a lot of the work that we've done so far has been connecting our base of volunteers that has been very engaged with other groups that have been doing the work for a while, like I've said. And in particular, I'm thinking that, a lot of our volunteers I think the neighborhood that we work with is a predominantly white, higher medium income than compared to the rest of Baltimore, which is predominantly Black and has lower income than our neighborhoods. So making sure that we connect those volunteers with areas of the city that we should be in solidarity with. So that looks like raising funds for a public housing project. We were able to raise $1,700 for the public housing units in Baltimore and Douglas Homes, and also helping out in providing direct volunteer support for food distribution for one of the Middle East communities in Baltimore, which is East Baltimore as well. So making sure that you cross those class lines and also along with what Sammy said about making sure that we recognize people that are experiencing homelessness is really crucial. So a lot of our work has been advocating for people that are experiencing homelessness, and having our group do a lot of kind of phone zap, helping to pass a resolution in city council that would go to putting people that are in homeless shelters or congregate living into hotels or other types of isolated home settings, because that is something that is really important, and our city has not yet fully absorbed that information. But with us and working with other advocacy groups, we were able to have that pass, a resolution passed in the city council unanimously. Still waiting on the mayor, since we live in a strong mayoral city, but that is a big element of what we're doing, is making sure people recognize that our work doesn't end with getting groceries for a neighbor who might even be able to afford it. It goes so much further than that. I think that our group is starting to learn that. Great.
Thank you, Zach, so much. And you like others, prove that you can feed and fight at the same time. Wonderful. Z.
Yeah, so one of the things that I see is the solidarity between immigrants and refugees. In Salt Lake, there is a pretty large distinction between resources for immigrants and resources for refugees, where we are very refugee resource heavy. And what I have seen is through this pandemic is the coming together of those two groups and being able to work together, where refugees are really stepping up and being very sympathetic on the fears that especially mixed immigrant families are facing. For instance, when we have the shelter, stay at home, stay safe directive that was put out by a mayor, the immigrant community was in a lot of fear. They're asking for papers to even go out the house. They're fearful that they might get stopped by law enforcement. And it was great to see that it was refugee colleagues or refugee residents who come up to us and said, we need to do something to make sure and to make sure that these families are feeling safe, and really advocated to the mayor and others to put out a letter saying to say that they are welcome here. We will not be reinforcing arresting individuals who are going to work, and really putting some assurances to the immigrant community. So that was a really great success to see that communities are really coming together in this time of need.
Wonderful, thank you all, and very good. And I think that there's a follow-up question to that for anybody. What do you see the possibility of this enduring? What do you think it's going to take to do that? So we see the start of feeding, fighting, but to be able to work across race, class, and other divisions as we look towards the future, which we have to do, and what do you see the potential of addressing this, to coming together, that kind of coalition in the future? Anybody jump in?
So this is so Ligia. I think as a movement, I think we are in a unique place to really come together with the specific demands, not only at a city, a state, but I think at the federal level. Specifically because I know the importance of us really responding as community together to the need, but this crisis goes beyond the ability of us as a community to be able to provide aid. It's, the people are dying not just because of the virus, it's because of the structural failures of this country and our cities. We have witnessed, I think, not only in New York City, even though we are one of the cities that people are dying. And if you ask people why they're dying, people would say, I'm not dying just because of coronavirus. I'm dying because I'm being turned away from the hospitals. I'm dying because I feel forced to go to work because I would not have money to feed my families. I'm dying because I don't have the ability to live in a city where 80% of my income goes to rent. So in order for us to come together, I think we need to start thinking about how we push a structural agenda that really transforms the systems that we currently live, right? We know we have a healthcare crisis. Before the pandemic, we knew the healthcare system was already failing, and we just witnessed that it is true. So now it is time to really think how we're going to fight back to change structural systems, obviously from the ground, from our cities to to change the current government we have. And for me, it's not just about providing mutual aid. It's about how we organize and empower our communities to transform the structural problems and failures we have in our cities. And it starts with the more basic, which is access to healthcare, access to better pay to those workers who are already on the front lines and have been on the front lines without access to not only healthcare, but health and safety equipment. It's about how we ensure that there is access to food. There has, poor neighborhoods have been food deserts for decades. And now it is visible because, the basics of it's not being provided. So for me, it's about coming with a structural agenda with a collective agenda that brings all movements together, but that it goes beyond providing mutual aid. It's about how we're going to transform a whole system that it hasn't worked, is failing us, and continues to and it has just showed that a pandemic it's the system who's killing the people.
Great. Thank you so much for that. Appreciate that. Anyone else? Tyson, Sammy Z. Okay.
I totally agree. This is Sammy. I totally agree with what I heard. I had a lot of connection problems, but from everything that I heard, I completely agree with. But I also think that we need a stronger government who is willing to make the decisions that need to be made so that people can have more protections, like you're talking about with, having the right to a job, to better pay, all those kinds of things. But we also need to have easier ways for community groups to be able to basically operate, because I feel like there's so much red tape in becoming a proper 501c3 and all of the paperwork and the fees and hiring lawyers and like in a crisis like this, we don't have time to do that. And I want to be focusing my time on helping the people and focusing on that, not learning tax code. And I think that there needs to be exemption for crises like this, because I know that a lot of the organizers that I'm working with are very nervous about, are we allowed to do this? Are we allowed to do that? Well, how much of this are we allowed to do? And so I feel like that is really hindering a lot of what we want to do, because we don't want to get in trouble for, collecting too much of the doing the wrong thing and getting in trouble. And so if there is less bureaucratic red tape to becoming an official organization so that we can do more and help more, I think that would really really help.
Great. Thank you, Sammy. Tyson.
Yes, and I was going to say what I think while we are responding in real time to what we are seeing out here and understanding, it takes a lot to understand the resources that are here in the community and making sure that those resources are getting to those people. But as I was speaking of before, what I think that we are experiencing here is an opportunity for people to really learn that we all are human. I think that as a divided community, as we are sometimes, especially here in the South where things are really segregated on racial lines, our communities don't know enough about each other. We have a lot of assumptions, like we think this community is this, we think this community is this, and it's because we're not in the communal spaces and talking. And I understand now with social distancing, we really can't do that as much as we can't, what we should. But what we are seeing is that now, especially with the volunteers and the community that has stepped up to come together to provide answers for the needs that we have for COVID, they are now forced to understand this community a little bit differently. And understanding that, this is something that affects all of us. It's not just something that's going to affect this community. So it's like when Ebola happened, Ebola was in Africa. So that wasn't in our community. So if we're providing aid and help, we're sending aid and help over there. But now what we're realizing is that this aid and help that we have to have needs to come universally all around. But what have you, that if this can have hurt us over here in this community, it's hurting this community as well too. And now we're understanding how we're inextricably linked. And I think that that right there is going to be something we can sustain moving forward. At least I hope, from a very you know, idealistic standpoint, to say, okay, if we learn anything from this, then this is it. And I'll say this last point too. I think that what we also are gaining from this is valuable data on what we can do. You know, before we had some assumptions about what would happen if a great emergency came about. Where will we do this? What we understand now is what we can do, and that valuable can do is going to help us.
Thank you so much, Tyson. I think it's really important, very important to understand the possibilities here. Anyone else want to speak to this question?
Yeah, I want to chime in a little bit. This is Z from Salt Lake. I think one of the biggest disparities I've seen is the disconnect between mutual aid agencies and government leaders and decision makers. I think that in order for us to move forward, we really need to close that gap. And it has to be coming from both ways, where governments have to play a bigger role in understanding who the mutual aid associations are and being able to support them. You know, the previous speaker talks about all the red tape and bureaucracy, and that's definitely out there. Unless we go and listen to the community and understand what the needs of the community, we will not change. And I think that this is a really important piece, that as we move forward, is to engage in dialogues and conversations and identify those allies and make sure that the system is, we are changing the system so that when the next time things like this happens, that structure is in place. I also want to echo and bring in the philanthropy sector. I think that they also need to play a really important role in this. There is definitely, we're seeing a gap in terms of fundings flowing down from philanthropy to the mutual aid associations, bringing in some of the discussions about not having a 501c3 status, what are the reporting requirements. Those are all barriers, and I think that we really have to look into infrastructure systems and evaluate whether or not it is working for our communities. Our communities are changing. There is a lot of disparities, and I think that we really need to bring those two sectors into the discussion as we move forward.
Great. Thank you, Z, and I'll take a step out of roles to say that I really support what everyone's saying. One of the things we've learned in our work nationally as well as locally here in Baltimore is that, and we, you know, those of us in Baltimore know that the mayor, now mayor, had a youth fund, a $2 million and $20 million youth fund that they thought they're going to get out to all these groups, but they had all these criteria. You had 501c3 organizations were the only ones that could receive it. 2 years later, you know, the work took a lot to build the capacity of these groups to handle the money. They're finally realizing that capacity needs to be built. So it really is a very important point right now, is that if it's going to go to the same old groups, we're really going to limit ourselves. And the groups that go deepest into these communities may or may not have that 501c3. They may not have the disbursement policy. So it's not only writing a check, but it's capacity building simultaneously to get it out the door, because that's what it's about. You're not going to ask for, you know, someone's going to offer you a meal. You're not going to ask them for their tax exempt status. So I want to see, Daniel, can we do the next poll? Is that possible on that spirit? Okay, so we're going to ask one more. Now let's get what you all think about this.
Yes, basically asking what you all think. Can this pandemic be an opportunity to advance social justice and equity? Give people a few seconds to fill this out as well. Okay, the votes are coming in. Okay. Let's see what we've got.
Yeah, there you go.
Awesome. This time I can share it. So overwhelmingly, I mean, yes, I think that's the general sense of what we're hearing, which is good. And I think a lot of what the panelists are talking about in terms of the systems, making sure things are overlapping and taking care of each other is really a good spark for that. So keep it up.
Great.
Keep it up.
Yeah,
everyone.
great. So with that, and Daniel, I'm for one of you know, working with me, I'm kind of improvisational theater is my thing. So I wanted just to kind of pursue this a little longer because showing that sort of, so now that we see the possibility, how, what is it going to take? You know, what is it take? What are some of the challenges? We talked a little bit about that, but what is it going to take to be able to do this, to be able to turn this towards, to continue this use as an opportunity to promote equity and social justice? What are some of the things? We talked about the barriers, and we talked about one solution, which is to not just depend on 501c threats. What are those things going to take? And we also heard about organization, the important to have organization and structure. So those are two things that I heard you all saying. What are some of the other things you think it's going to take to be able to continue this, not only to feed, but also to fight for justice?
Oh, I'm sorry. Thank you, Lydia.
Okay. Zach, why don't you go this time? Okay.
Sure. So I don't have an answer completely, but I think that we've seen that, at least personally, I think that yes, we should be seizing this moment to push for more social change, to be pushing for the things that we all need, that the working class needs, that the people that are most disadvantaged by this situation are getting everything they need to be made whole. And we need, and it kind of underlies just how flawed our system, how even though this has been made up of people who are doing the really impossible work, that the systems themselves have failed them. And so we have to take advantage of that, but recognizing that it is simply not enough. You know, a one-time stimulus check is clearly not enough. In fact, especially for the people that are not receiving those stimulus checks, do they not deserve to get food and resources as well? So I think that we need to look hard at the systems that are in place, the people that control our government and control policy, and not just look at those and make sure how do we change them transformationally, but looking at how we're looking to a lot of nonprofits right now to provide funding in a pandemic, and it's because we're in a desperate situation. Me and Sammy were talking about this before, and I think that it was a really great insight, is that we simply are in desperate times, and that's why people on the ground need these things. So I think that in order to advance those changes, these nonprofits and these organizations and these groups that have the power need to look inward at the structure of them and the composition. Are these groups, what is the makeup of them? Because if they are not led by people of color, by the working class, by immigrants and refugees, by people that are poor, then how are they ever going to undo those systems that are in place that are disenfranchising people? And I think to that is, if those groups do not make those changes, and I don't think they will make it, I don't think those groups will make those changes on their own. It takes the people to force those changes, kind of stressing those changes. Otherwise, we won't have nonprofits kind of making difficult decisions like pushing for decarceration or pushing against things that policies that gentrify neighborhoods. And these groups need to also be supporting general strikes and supporting the labor community if we were going to actually make real change, because otherwise it will only be crisis management, and that's not sustainable. So yeah.
Great. Thank you, Zach. And I know you have to go momentarily, but thank you so much for that. Licia?
Yeah, I do echo first, the need to build and strengthen the community organizing and infrastructure that exists, or that it's sort of coming out of this disaster, but also recognizing that there are movements that have been fighting for the things that we are fighting now during the crisis. There are there is a whole movement of worker centers across the country that have been fighting for basic protections for farm workers, which are the people who are feeding right now entire America. Worker centers who have been fighting for restaurant workers who are now delivering foods, fighting for warehouse workers who are actually packing now everything that every essentials that Americans need. So I think, one, recognizing that they have movements, and I think creating this space for these movements to come together to build collective power across sector during the crisis, but also for the future. And I think that requires bringing group, like I think the same thing you guys are doing right now, which is creating a space for different movements and organizations to come together to talk about what's happening, as it was said, but also not only to talk about it and learn about what we are doing, but really develop a collective analysis and a strategy about how we're going to win. First, what is needed for the ones that are suffering the most, which happens to be first essential workers who are on the ground picking up your tomatoes, the workers who are delivering the food, who are keeping the streets clean, about how we can address the needs that they need so we can keep them safe. And then the people who are also the working class people who are suffering because don't have a safety net and were excluded and are completely excluded from any government relief programs. And also Americans, regular Americans who are also suffering, right? And building, I think that's one, creating a strategy. And I think we also need to build like a long-term foundation or collective structure for this movement to fight, not only during the moment of crisis, but how we're going to be aligned and working together to make structure changes, not only in our cities, but at a more long-term, in the long term. And I think that needs to happen, which, and I think this is a great space as how not only we can get together, but like what's the follow-up of this, like how movements are going to be developing strategies to win the changes we need to win, not only to transform and change the needs that we have currently now during the pandemic, but how are we going to transform the entire our history, because that needs to happen, because our system has not been working for working class Americans and migrants.
Great, thank you so much. That's so important. We said, anyone else on the panel want to comment on what we can do? What's the potential now for that kind of movement that I think you very articulately spoke about? What are the things, the concrete things, the steps that we can do? How can we make your efforts stronger? I know there's money directly to distribute, but if we looked at the needs of your organizations to be stronger, to be effective, and achieve what what we're just talking about, that kind of movement, what do you see needed? What are the steps for that? What are the ingredients? Yeah, go ahead. Sorry.
Well, I'd like to echo what everyone has said about big structural change being very much needed. But I think that what also needs to happen is also on the micro level. People need to get active. And I say this knowing that not everyone can go out and get groceries for the elderly. I personally am immunocompromised and am a chronically ill, disabled person that cannot leave my house. And I am I'm organizing digitally, and I'm helping my community in that sense. And there are ways that you can help in whatever capacity you have. Something, for instance, I know that no matter where you are, food banks have been getting an increasingly high demand for need of their services, and their volunteer levels have been plummeting because people are sick and they're afraid of getting the virus. And a lot of their volunteers are the elderly. And so if you're healthy and are able to, I would suggest reaching out to your local food bank and seeing if you can help them, because we can't get social change on a big level if people don't survive this. And we need to get their basic needs met first, because I know that there have been so many powerful moments that I've had with people changing their views on big world things on a very personal level. When you're working with someone and you explain to them, you know, if I didn't go to the food bank today and get this food, my family would have gone hungry for the rest of the month because I only got this amount of food stamps, you know, and teaching that person what your reality is can change their views. And so small things can make a big impact on people. And so I know that we want to make big change, but sometimes that big change can come from small things. And so I just want to reiterate that there is literally something that everyone can do. It's just a matter of figuring out what it is. And I will be giving David lots of resources and opportunities for people to get involved to send out in an email afterwards.
Great. Thank you, Sammy. And that was great. And I wanted to do probably the second most common question we get next to, is this webinar going to be recorded, which is yes, is how do you organize digitally? What are some of the tips maybe you could share with folks very quickly? Because it's different. I'm an organizer, you know, you're used to door knocking, door to door. Some thoughts on that? How do you digitally organize? What are some lessons? Anyone? Sammy, anyone?
I think this is C. A couple of things that come into mind. I think that one thing is that we have to acknowledge there's a digital divide in the communities. So when we talk about having a Zoom conversation, or you know, even doing your homework at home, we have to make sure that the technology there is accessible by everyone. So I think it's important for us to look into apps that are more lenient to individuals who use phones instead of a computer. And I think those are the lessons that we need to learn, is to be robust and be nimble in terms of making sure that in getting people together virtually, that we're doing it in an equitable way.
Great, thank you. Others, Leah?
Yeah, I was gonna say, I think just learning what has been our challenges, but things that we have learned is what technology is accessible, as you was previously said, to the people we aim to support and help. Like in our case, it's mostly day laborers, domestic workers, and we know Zoom has been a big challenge, right? Like it seems to be very easy when for people who have smartphones, and knowing that not everybody has smartphones, so that wouldn't work, right? So what we're trying to develop right now is one, find ways to figure it out, either whether it's like, you know, small brief phone calls with a small group of people, using WhatsApps. We're recording videos and sharing it via WhatsApp so workers can have the information that they need. We're also trying to, one of the biggest things now that we have to adapt, I think, in a new era, has been about actually training and mentoring workers to use the technology that is out there. One of the workers, you know, was mentioning, you know, how I'm going to connect if I cannot access to Zoom, and others, interesting enough, one of the members said, you know what, we just have to learn, because that's the way we will have to survive. But that also, for that to happen, I think it's right. I think we need to support workers, and yes, provide essential need, making sure, you know, workers do, or people who need, have smartphones. I think, you know, are able to pay their monthly bill. If they're not working and can't pay rent, most likely we're seeing that more workers cannot even afford to pay their own phone bill. So yes, we need to support, I think, making sure resources are put in the ground so we can use technology in a way to organize.
Great, thank you so much. So this is a very intriguing and important discussion, and hopefully just the beginning. I just realized we're coming to that magic moment of ending this. I am sorry about that. So I'm going to go through quickly. I just want to say that these are just examples of wonderful things and the importance of this conversation. We want to use this to be able to kick off a longer discussion like this. We can't answer them, but I want to thank everybody. I've just been honored to be part of this and to listen to you all. Very inspiring. And I think this is just, we're in the beginning. We can't see this at the end. I appreciate your optimism, your hope, and those of others. Very quickly, Daniel, if you can go through with me the last couple of slides here, and I apologize to the audience for the late start, you know, to bug through, but we are, you know, developing this community action learning network. It's a prototype. We're starting out here in Baltimore. And I think that one of the things we'll do is just try to get this together. So we were going to ask, and there's a spelling error because communities are spelled wrong. So as I said, I can't type, but it's communitiesrespond.net is a starting place. Also, we'll be sending out a link to a Facebook page to be able to continue this conversation online. And finally, Daniel, if you go to the next slide, I just wanted to do a promotion very quickly for our next webinar in 2 weeks. We'll have a lot of these bugs worked out, around 10 principles for bridging communities in a time of crisis, and really talking more about some of the issues that we've started to discuss today. So I want to thank our panelists, thank everybody for their time and effort in this. Again, my admiration, appreciation for all the work that you and others are doing, that what makes this opportunity, but also reminds us how great people are. Under the worst of times, I've been blessed to see the best in people. And I think we also have to remember that as we go into the future, that we can make a difference. People are making a difference. As I said, there's been long struggles, and now is an opportunity to do a lot about it. So I want to thank Daniel and my team, and Evelyn and the others, and Jiwan and people at Community Science who really made this happen. And I get to just make spelling errors and my buffoonery. So, but thank you all so much for that, and stay safe, stay healthy, and keep on caring. Don't give up. Thanks all. Take care.
Thank you, everyone.
Thank you, everybody.
Thank you.
Thanks.
And I'll be the last man standing.